Hi friends, welcome to Smile Nursing Tutorial. Today we are going to discuss about the reproductive system. First, what is reproductive system? The reproductive system or genital system of sex organs within an organisms which work together for the purpose of sexual reproduction. Okay. Next, what is ovulation? Ovulation is mature egg is released from the ovary and pushed down the fallopian tube and is made available to be fertilized every month, and egg will mature within on of year of ovary. Next, what is menstruation? Menstruation is also known as period or monthly is a regular discharge of blood and mucosal tissue from the inner lining of the uterus through the vagina. Next, what is proliferation? Proliferation is a rapid multiplication of the parts. What is false pelvis? The upper border portion of the pelvic cavity is called false pelvic cavity. Okay, today we will speak about the functions of female reproductive system, in that genito-urinary system. The genito-urinary system includes the organs, structure, the male and female urinary system, the male and female reproductive systems. The genito-urinary system is responsible for a function of hormone production and regulation, reproduction, and filtering and excreting waste. It is located in the abdomen and pelvis. It interacts work together with every other system in the body. It also includes the musculoskeletal system, nervous system, circulatory system, immune system, respiratory system, digestive system, and endocrine system. So, the male and female organs differ anatomically and physiologically. Next, both males and females produce reproductive germ cells called gametes. The male gametes are called spermatozoa and the female gametes are called ova. They contain chromosomes or genes which pass characteristics onto the next generation. At fertilization, an ovum and spermatozoa fused together and is resulting is called as a zygote. The zygote embeds in the wall of the uterus where it grows and develops during the 40-week gestation period before birth. Okay, till now we have discussed about the genito-urinary system. Now coming to the function of the female reproductive system, in that formation of ova, reception of spermatozoa, provision of suitable environments for fertilization and fetal development, parturition and lactation. The female reproductive organs are divided into external and internal organs. Coming to the external female reproductive organs are vulva, labia majora, labia minora, clitoris, vestibule, hymen. Next, internal female reproductive organs are ovaries, fallopian tubes, uterus, vagina and breast. Next, coming to the pelvic bones. There are 4 pelvic bones. One is 2 innominate bones, second 1 sacrum, third 1 coccyx. Next, in innominate bones, each innominate bone is composed of 3 parts: ilium, ischium and pubic bone. Next, coming to the pelvic joints. There are 4 pelvic joints. 1 symphysis pubis, 2 sacroiliac joint, 1 sacrococcygeal joint. Next, coming to the pelvic ligaments. Each of the pelvic joints is held together by the ligaments. Intrapubic ligaments are the symphysis pubis, sacroiliac ligament, sacrococcygeal ligament. There are 2 other ligaments available: sacrotuberous ligament, sacrospinous ligament. Next, pelvis is divided into true pelvis and false pelvis. Next, diameters of pelvis. One is inlet, second is antero-posterior, third is obstetric conjugate. Next, oblique diameters, sacrocartiloid. Next, coming to the types of pelvis. There are 4 types of pelvis. One is gynecoid pelvis, second is android pelvis, third is anthropoid pelvis, fourth is platypelloid pelvis. Female pelvis is known as gynecoid pelvis. Next, male pelvis is known as android pelvis. Okay, today we have discussed about the genitourinary system and function of the female reproductive system, types of pelvic bones. Next, pelvic joints, pelvic ligaments and diameters of pelvis. Next, types of the pelvis. Thank you for watching this video. If you not subscribe my channel for new updates. Okay, bye. Next, we will meet with another video.